Well, eating disorders are serious and in some cases life-threatening, so much so that it impacts not only your physical health but your emotional well-being. And sadly, in the past few years, there's been an increase in the number of kids and teens here locally fighting eating disorders. Joining me now is Dr. Holly Gooding from Children's Healthcare of Atlanta. Dr. Holly Gooding, thank you so much for being here with us. How are you?
I'm doing well. Thank you so much for highlighting this important topic.
Absolutely. Now, Dr. Gooding, since 2019, we've seen the numbers rise. Do we know why more kids and teens are struggling with eating disorders?
Well, we don't know exactly why, but there's lots of research in the area. Certainly, we were seeing a rise even before the pandemic, and a lot of people think that things like social media, which you highlighted in that earlier segment, could be at play, given that teens are spending a lot of time, and even younger kids, focusing on images of themselves and others online.
Dr. Gooding, it's so important to understand for parents and caregivers, loved ones, friends, all of the signs of what to look out for. So would you mind breaking those down, just some of the biggest warning signs that we can help these parents and caregivers try to diagnose maybe or figure out that their child may have an eating disorder?
Absolutely. So I think the first thing is to dispel some myths. Eating disorders can happen really at any age, not just in adolescence or young adulthood, and they can happen to both boys and girls, and really to any family. So some signs that people want to look out for is if you see your child eating significantly less or more than they typically do, if they've started limiting or avoiding entire categories of food, particularly if those are things they used to enjoy, if they're avoiding eating with you as a family or with friends and they're eating alone or eating in their room, and if they're doing things immediately after eating to compensate for the eating, so things like going immediately to the bathroom or exercising immediately after eating. And then, of course, certainly if you're noticing a change in their weight or shape.
Now, we know kids and teens hear everything, you know, that parents and loved ones and they watch things on social media, as we both have talked about today. So, you know, how important is it for parents and loved ones and caregivers to have their own healthy relationship with food and body image, so not to project a negative, you know, image of unhealthy eating and eating disorders?
Yeah, so it's absolutely essential, right? Kids learn what they see modeled by us. And so especially with the pandemic, with people home, with people perhaps eating differently, eating more at home, different foods, we want to make sure that we're modeling the idea that foods fuel our body and all foods are healthy in moderation. So we want to avoid diet talk, weight-focused talk, restricting certain categories of food ourselves, and we want to focus instead on food as healthy, food as energy, and doing things together like cooking and moving our bodies together as a family.
Dr. Gooding, thank you so much for all of this today. We really appreciate you breaking this down, and hopefully more people can be aware of the things that you mentioned and prevent and help children and teens and everyone who may be suffering from an eating disorder.
Absolutely, and don't forget you can check out some more preventive tips on the Children's Strong for Life website. Thank you so much.
We absolutely will. Thank you. And for more information on today's segment, you can head over to where Dr. Gooding said, and you can also please head over to our website, fox5atlanta.com, click the Scene on TV tab.